Om Swastiastu. My name is Laksmana, ID number 016. Good morning, good afternoon, or good evening, Dr. Atnyana. Today I will present about gout arthritis. Okay, gout is common form of inflammatory arthritis, characterized by recurrent attack of painful joint pain. A gout attack occurs suddenly, often at night, and the affected joint is swollen, red, and warm to touch. And then the initial attack, usually one involves only joint, and most often in the big toe, and lasts a few days. Subsequent flares may involve multiple joints and can last for weeks, with shorter interval of remission in between. Gout is caused by deposit of uric acid or uric crystal in the joints. So in the joints or joints has a uric crystal in there, and which may happen when blood levels of uric acids are too high. Uric acid is a waste product of the purines, or maybe we can call it a waste product from the breakdown of purines, and a major component of DNA and RNA. So the uric acid is a major component of DNA and RNA. And because body cells are constantly renewed, so the uric acid is constantly produced and removed in urine. And high serum urate level may result from decreased urate excretion, increased urate production, or overconsumption of purines. And the most common cause is the kidney decreased ability to excrete the uric acid, which can be hereditary or a result of kidney disease. Maybe can medication such as diuretic and alcohol use, or maybe a lead poisoning. Increased production of urate may occur in condition with abnormally high cellular turnover or cell death, or obesity, as urate production increases with greater body surface area. And overconsumption of the purines-rich food can contribute to high level of urate, or can contribute to higher urate level. So the urate itself has a level that can be higher when we or us eat some food that has a purines in their advantage. And but it's rarely the only cause. So the food is not the only one causing not the only one cause a gout. And high concentration of urate promotes is precipitation and formation of crystal in joints, causing inflammation and pain. Okay, next is because uric acid crystal crystal form more easily in cooler temperature, gout more often affect joint of the extremities, and uric crystal may also deposit under the skin around the joints, forming hard lumps called topi. So there are topi that are not usually painful but can limit joint motion and lead to deformities. So the topi can make a limit joint and can make deformities. Joint damage caused by gout also increase the risk of developing gout arthritis. So the joint damage caused by gout also increase the risk of developing gout arthritis. And in the kidney, urate deposit may form stone blocking urine flow. And gout is more common in men. It may be often starts in middle age in men and after menopause in women. And other risk factors include diet, obesity, other health condition, family history, and surgery or trauma. Okay, next is diagnose. The diagnose requires detection of urate crystal in synovial joint fluid. And because not all people with high serum urate levels develop gout, a blood test alone is not sufficient for diagnosis. And acute gout attacks are treated with anti-inflammatory such as NSAID, and regular use of which may also help prevent or reduce frequency of gout. So the NSAID is regular use, which may also have prevent or reduce frequency of gout. And then because topi can be dissolved by lowering serum urate, medication block urate production or increase urate excretion, and maybe that be used for this purpose. And maybe that's all about the gout arthritis. Thank you, and I hope you enjoy the video. Thank you, Dr. Anjana. Om Santi 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 Om.